So the biggest advancement in rectal cancer management has been the evolution of multidisciplinary care, and it has happened because each modality has underwent good advancements. If you come to surgery, robotic surgery in our experience at Apollo Proton has increased the patient quality of life by reduced morbidity, reduced surgical stay in hospital and early recovery, which helps us to start our further treatment faster and without much difficulty. And in case of radiation, different modalities like intensity modulated radiotherapy etc. has improved the radiation outcomes. Specifically, proton therapy is useful for patients who have high age, who have multiple comorbidities and also have difficulty in tolerating chemoradiation. Reduced doses to the bone marrow, reduced doses to the things like bladder has improved their tolerance. Coming to systemic therapy, immunotherapy is the biggest advancement that has happened in last 2-3 years. We have drugs like dostarlimab, which has improved the response rates, and the need for surgery, the need for radiation is not there. Patients only with 9 doses of immunotherapy are able to avoid surgery and radiation and live normally and healthy. But it should be noted that this is only useful for specific cancer populations called deficient MMR or MSI high, and is not for all the rectal cancer patients. Together, these advancements have created a better multidisciplinary protocols and a personalized treatment option for the rectal cancer patients. Multidisciplinary care is specifically used for rectal cancer patients because all the 3 modalities, surgery, radiation and systemic therapy, have been used in this rectal cancer management. Now MDT means apart from the surgical team, radiation, medical oncology team, we have the involvement of radiologists, pathologists, interventional radiologists who are able to give their inputs to exactly characterize what is the stage of the tumor, what is the extent of the disease, what are the things that are high risk. Now, when we sit together and discuss these aspects, it is important that each person's opinion is taken into account and together we make a strategy as a personalized treatment protocol. So, when we use this, everyone gets their treatment on time without any delay, and it happens as per protocol and without any further issues of delay in referral, without any issues of more toxicity. The treatment gets so better quality of life, better effective disease control and better outcomes are there with MDT. Now, colorectal cancers, we see around 25% of the colorectal cancers have a syndrome called Lynch syndrome, which is associated with hereditary risk of developing colon cancer. Suppose a patient has colon cancer with Lynch syndrome, it is important for us to exactly find out from blood tests whether there is a hereditary risk or not, which is called as germline testing. If it is positive, the first thing is to have a genetic counseling of the family along with the patient to understand what are the risks for each member of the family, and accordingly there are simple blood tests that can identify whether they are at higher risk of colon cancer. Suppose they are at higher risk, suppose they also have the same gene mutation, there are screening programs. Now in colorectal cancer, screening programs are simple. There is something known as occult stool test or fecal immunohistochemistry test, which helps us to find out whether there are traces of blood in the stools, which gives us an indirect indication whether there is a tumor inside the colon. And there is something known as colonoscopy, which is very well done with a mild preparation, which can be done and found out whether there are any polyps. Now the importance is that colon cancer usually develops over 5 to 10 years from polyps, and if we are able to identify the polyp and remove them, we can completely cure the colon cancer, and that's why we can prevent them from developing a cancer even when they don't have it. So especially family members, the primary first degree family members, that is son, daughter, the brother, sister, father, mother, they are the first degree relatives. They should undergo specific genetic test if their family member who has been diagnosed with colorectal cancer have mutations which is known as MMR mutations or which are known as MSI high or Lynch syndrome. In these situations, it is important to do the colorectal screening, the colorectal genetic testing and the colorectal screening. It can completely prevent the occurrence of cancer in these people and keep them healthy for a long time.